Welcome to DeftXR, medical education and hands-on training with virtual reality. Here is an introduction to human anatomy. We have built several modules as you can see on your screen. So this is on the right hand side, you are seeing what the user on the left is actually seeing in a virtual reality environment. So this is how the virtual environment looks like.
The clavicle is also known as the collarbone and is a long bone. It lies in front of the root of the neck
And this is how
takes part
the
in
learning
formation
happens
of the shoulder girdle.
in virtual reality.
It transmits the weight of the limb to the sternum. It has the following parts: shaft, which is cylindrical in shape, and two ends, medial end and a lateral end.
You can use both of your hands to interact with different parts of the body. In this case, the user has picked up a clavicle bone, and you can see various parts of the body like ligaments, muscle insertions, muscle origins on the bone itself. You can see it from all the angles as many times as long as you want to go into the depths of the subject and to understand it more clearly. So this is how you can interact with different elements in the virtual environment. And similarly, there are different modules like site determination, features, peculiarities,
The lateral end is flat and medial end is
etc.
large
can
and
be learned
quadrilateral.
in a virtual reality environment.
Shaft is curved convex forwards in its medial 2/3 and concave forward in its lateral 1/3. The inferior surface is grooved longitudinally in its middle 1/3 road. It has a shaft. The shaft is divided into two parts, lateral 1/3 and medial 2/3. Let's look at the lateral 1/3. The lateral 1/3 of the shaft has two borders and two surfaces. 1. The anterior border is concave forward. 2. The posterior border is convex backward. The two surfaces are: 1. The superior surface, which is subcutaneous throughout. 2. An inferior surface which shows conoid tubercle and trapezoid ridge. Now, let's look at the medial 2/3. The medial 2/3 is rounded and has four surfaces. The anterior surface is convex forward. The posterior surface is smooth. The superior surface is rough. The inferior surface rough and has an oval impression at the medial end, and lateral half has a subclavian groove, and the nutrient foramen lies at this groove. The nutrient foramen transmits a branch of suprascapular artery. The clavicle has a lateral end. It is also called as an acromial end, which is flat. It bears a facet that articulates with the acromion process of the scapula to form acromioclavicular joint. Medial end, it is also called the sternal end, which is quadrangular and articulates with the clavicular notch of manubrium sterni to form a sternoclavicular joint. Let's check the clinical anatomy of clavicle. Commonly fractured by falling on the outstretched hand, indirect violence. The most common site of fracture is the junction between the two curvatures of the bone, which is the weakest point. The clavicles may be congenitally absent or imperfectly developed in a disease called cleidocranial dysostosis.